Hi, my name is Randi and I had to do a project for my abnormal psychology class where we had to pick a disorder and talk about it, and we had to pick a book to go along with our disorder. For my project, I picked Alzheimer's disease. Alzheimer's disease is a form of dementia. Dementia there's many different forms. It's when someone has trouble remembering. And for my book to go along with the disorder was by Pat Moffat. It's called Ice Cream in the Cupboard, A True Story of Early Alzheimer's Disease. In this book, Pat details his life of taking care of his wife, Carmen. He described his wife as a fun, witty, intelligent woman who was very involved in her work before she was diagnosed with Alzheimer's. Carmen started showing signs and symptoms. She started having lapses of memory of where she's putting things, like she'd put groceries in the wrong place. She would also forget certain things and get very hostile about it, feeling like Pat, for example, was just teasing her. But she was actually diagnosed with early Alzheimer's disease, which it was difficult for them to diagnose her with. The reason it was difficult because, for one, she was diagnosed early. Early Alzheimer's can affect anyone in their 30s, 40s, 50s. Well, she was diagnosed at age 53. And regular Alzheimer's disease strikes any time from age 60 and above, and once you hit age 85, your risk for developing Alzheimer's increases greatly. The way that Alzheimer's disease gets diagnosed is through extensive histories, medical histories. They might do a CAT, they might do an MRI, but there's no definite diagnosis of Alzheimer's disease till after the person dies, and once that happens, they do an autopsy to see what happened in the brain. The reason they do this is because they're looking at the brain to see what's going on inside, to see the changes. Your brain slowly deteriorates. Risk factors for Alzheimer's disease are advancing age, for one. They think genetics could possibly play a role in it, such if you have a brother, sister, mother, father, your odds increase greatly. Also, another reason that you might be at risk is if you're African American or Latino, you also are at a greater risk. There are many signs and symptoms of Alzheimer's disease. There's actually 7 stages, and you progress from no symptoms to severe symptoms. In stage 1, there's no signs or symptoms showing. You're going on fine. Stage 2, you start to lapse. Little lapses of memory. You progress more. You reach about stage 4. You're forgetting more. You start to forget such thing as your address, your phone number, where you even went to school, until you progress more to stages 7, which is the final stage. During that stage, you're relying completely on a caregiver, such as what happened with Carmen and Pat. She progressed to that, and he actually had to put her in a long-term facility. Long-term facilities are where people can go if they're having extreme difficulty, if their family can't take care of them anymore. It just begins to be too much. The thing that put Carmen in a long-term facility is that she began to wander, which is actually a sign and symptom. As you progress, you actually forget where you're going, and Carmen would get up, wander around, and he was worried about her. So he put her in the facility. She actually lived in that facility for 3 years till she died in 2010. Other signs and symptoms besides losing your memory, you might become more hostile. You're easier to anger, you become upset, you're moody. As was Carmen, for example. One time they were driving home, they pull up to their home, and Carmen's like, "That's not my home, that's not my home." So Pat just compromises to calm her down by saying, "Well, we're just going to walk the dog. It's the neighbors, we're going to walk their dog." So Carmen goes inside, gets the dog, and walks it when she's actually walking their own dog. There's actually no cure for Alzheimer's disease, so you're using drug therapy such as antidepressants or antipsychotics that relieve anxiety to help lessen some signs and symptoms of the disease. Ways that you can help is you can watch for it. There's warning signs such as lapses of memory. Usually it's family and co-workers that actually notice something's up. They're usually the first ones to notice or really think, wow, something's actually really wrong. Even though there's no cure, there's actually clinical studies that go on. And during these clinical studies, a person might be put on different drugs to see if they can find something that's going to work to cure this disease, because on average, a person may live 8 to 10 years, with people actually living a lot less. There's actually around 5.1 million people suffering with Alzheimer's disease in the United States. These people are all at different stages, some just being diagnosed, some at the end of the spectrum of the disease. Some things that are best to do are palliative care. Well, what's palliative care? Palliative care is when you are providing comfort. You're just trying to provide comfort to make it easier for the patient. Such as when Pat cut his work hours from 60 hours a week to 30 so it could help Carmen more as she was progressing through her disease. And the thing that's the hardest for family is when the person they care about starts losing their memory. They forget who they are. They might think that their granddaughter's their daughter or such things. And in the case of Carmen and Pat, she couldn't remember who he was at the end, but she'd always tell him, "I love you," which meant so much to him. Even though they might not realize that that's you, it actually means a lot hearing those words. And Alzheimer's disease is just a hard thing to decide whether to keep the person at home or if you're going to put them in a long-term facility. It really just depends on the family, what's going on with the patient, how advanced they are, what's best for the patient, which can be sometimes the hardest decisions, because sometimes it's best they're in a long-term facility, such as it was for Carmen. And even though Alzheimer's disease is really hard, sometimes it brings the family closer. It brings them back to realizing what's really important. For the person diagnosed with Alzheimer's disease, usually the hardest thing is losing their memory, because they start out they can't remember new information, they're slowly forgetting how to figure out math problems, they're having trouble reading, writing, everything like that, which can be very hard for a patient, because sometimes they don't realize they're doing it, or they might repeat themselves numerous times. And sometimes hospice has to be brought in for Alzheimer's disease. Hospice is an end-of-stage nursing care that can be done in the home, which sometimes works best for the family because they're able to keep their loved one at home, but a nurse from hospice can help relieve the family some. The family can go out for a little bit and have that nurse stay there and help them. And hopefully there's going to be a cure for Alzheimer's disease someday. Well, that's all I have to say about this. Thank you for listening to me, and hopefully you learned something.